those are the latest COVID-19 related numbers brought to us by the Health Minister, Vuyo Mvoko, in that virtual press conference last night. For more now, I'm joined by eNCA political editor Vuyo Mvoko, who's been tracking the story for us. Now, Vuyo, thanks for coming in this morning. I was saying now more than ever, the whole country pays attention when Health Minister Vuyo Mvoko speaks. That's not to say that it hasn't been important where he's spoken before, but it has really become, and I don't want to use a flippant word or phrase like a numbers game, but are these percentages that we're seeing fluctuate or rise and fall has now become this new norm when reporting on the story. There's good news, there's bad news. Bad news is 251 new cases. The good news is it's also the second highest number of tests in a single day. This is the world that we operate now in terms of COVID-19 numbers.
Yeah, look, I mean, yes, you're correct, Michelle. I mean, it is about numbers, but it is also about a whole lot of other things at different levels. You know, when Vuyo Mvoko does what he did yesterday evening, he exudes both the confidence but also inspires people. He gives everyone the sense that he is on top of his game, he knows exactly what is going on, and takes care, thinks about, but also commits to the next step and the step after that, which I think is very important because there's a great deal of uncertainty and people are really scared. They're scared at different levels. Yes, there are the deaths that keep on rising. The infections also keep on rising. And he is frank and open, you know, about that. Even last night, we were saying, look, the more people we test, these numbers are going to continue to go up. But I think he contributes so much to the level of understanding of what exactly is going on, but also to inspire people to say, look, you don't have to be sort of overly anxious. This is not the end of the world. We just have to continue doing the right things that you know we've been doing, and that is what is important at this stage.
He did point to the fact that while he is encouraged by the fact that we're seeing a steady rise in the number of tests that they can do, he pointed to the community screening program that's helping a lot in identifying people that need to go for tests, because a lot of those tests have up until now been in the public sector. But he says they're still way off the target of 30,000 tests per day. Yes. Has he spoken about what they need to do to get even close to that target?
Well, I mean, there's quite a number of things. One is the availability of the equipment to actually go there. I mean, we have more than 10,000 people who are out there like actually doing the tests, but the speed with which they have been able to, I mean, you've had to do that is what is currently problematic, you know. I mean, I remember only over a week ago in the Eastern Cape, I think it was in Port Elizabeth, you know, the whole thing stopped midway through because they ran out of, you know, equipment, you know. So you still have those challenges because they are in short supply the world over. But one of the comforting things from what you were saying last night was that I can't remember, he mentioned one country, I think it was no, it wasn't Taiwan, where he said, by that country, we've actually done more tests than most people in the whole wide world. This includes, I mean, very resourced, rich countries like the United States of America. So it is really, I mean, that's a good story to hear. Of course, it offers no comfort, you know, to people who are anxious, who say, I haven't seen anyone coming to test me, or I haven't seen, you know, these health workers in my area. And that's, I think, is what he was speaking to, because the more people you test, but also, I mean, if you look at it, he referred to something called, I think, worldometer or something like that. Which is that when you look at the numbers, you know, that we have, we really have low numbers, and if only we could continue to do the right thing so that we keep those numbers at that. In other words, we don't suddenly see a huge spike, you know, the minute, you know, we test as many people as he would wish.
Now, we are expecting a spike of some kind when we do get onto the other side of this lockdown, and that was part of the conversation as we end this conversation. the President's Coordinating Council had a meeting where they discussed the gradual easing of regulations. Do we have any idea, or have you heard anything about what that could potentially look like? Because in as much as this lockdown has brought us time in terms of curbing the spread of the disease, our economy can only take so much.
Yes, I mean, easing the regulations and, of course, kick-starting, or restarting the economy is part of every conversation that is going on now. But as that meeting also agreed, the important thing now is to make sure that there is a management of this process, that you don't, whatever you do, if you're going to allow people to start trading again, you can't do that recklessly, because otherwise you're then going to undo everything that we have done up until this point. Of course, what that meeting also highlighted was the plight of people on the ground. A lot of people who need food, a lot of people are poor, the plight of the homeless, and that really, my understanding was the conversations revolved more around those issues than a sort of the haste to get, businesses, to get the country to go back to normal again. And there is an understanding that at this stage the environment is not really conducive for a return to normality, which then brings us to a very important meeting that has to happen tomorrow. Remember, last week the 5 clusters had submitted reports to Cabinet. Those reports were scrutinized. For instance, I mean, there has to be a decision tomorrow about what happens to SAA. Do we give money to SAA or do we give money to health? Because with the management of this pandemic, the health costs have spiraled and are going to continue in that direction. Money has to come from somewhere. So there's a very important meeting of Cabinet tomorrow, where we will, I think after that meeting, we will get a sense as to what the thinking of the government is exactly about sort of getting more and more industries to sort of start operating, about the extent of hunger and desperation
and
within communities, and whether in fact we're getting the instruments we need for that rapid and massive testing that the Minister of Health was talking about. So tomorrow is really one of those important days that all of us would be looking forward to.
And I'm sure you and our colleagues here at eNCA will bring us the very latest, very important meeting there, as pointed out by eNCA's political editor Vuyo Mvoko. Thanks for your time and for those insights this morning.